This is Dr. Valerie Sutherland with your daily dose of information on weight management and metabolism. We've talked so far about the concept of a weight set point, and that when you lower your body weight, there's metabolic adaptation that contributes to weight regain. Part of this metabolic adaptation is a reduction in your basal metabolic rate. Your basal metabolic rate is the number of calories that your body burns in a 24-hour period. What contributes to that? A large portion is your lean body mass, and this is determined in large part by your height and your gender. So for example, a young man is going to have a much higher basal metabolic rate than an older, shorter female. However, your skeletal muscle mass contributes to your lean body mass and your basal metabolic rate, and you can affect your skeletal muscle mass. One thing that I commonly see is people who have lost a lot of skeletal muscle mass through weight cycling. What this means is that when body weight is lost, traditionally with things like cutting calories and increasing cardiovascular exercise, which of course is what everybody's told, right? Eat less and exercise more. 20% of the weight that is lost is actually lean body mass. And so this exacerbates the reduction in the basal metabolic rate that's part of the metabolic adaptation of weight loss and makes weight cycling even more likely. So when you're losing weight, you want to try to preserve your lean body mass, and this can be done through making sure you have adequate nutrition, and we focus more on preservation of skeletal muscle mass through the exercise during the weight loss phase. So kind of doing the opposite of what most people do, making sure that the resistance exercise regimen is appropriate for the individual's level and starting skeletal muscle mass. So if you have lost weight before, you may have lost a significant amount of skeletal muscle mass, and you may need to adjust your nutrition and your exercise for actually gaining back skeletal muscle mass. Whereas if you're just thinking about weight loss, then you may actually be exacerbating that loss of lean body mass. So we measure a body composition using an in-body machine. There's other ways of measuring a body composition. You can do them with equipment such as bod pods or submersion. There's also some formulas that have been tested that just use body measurements, like circumference measurements. So those can be done without any equipment at home. But kind of think about whether you think you've lost muscle or whether you need to build muscle, and you may just kind of have an intuition on your own. Another thing that affects the basal metabolic rate is something called NEAT, and that's an acronym for non-exercise activity thermogenesis. That is the activity that is done that is not exercise. So many people, when they think of burning calories, they'll think of focused exercise. So it's important to know the difference between physical activity and exercise. Physical activity is anything that you're doing when you're not sitting. So what they look at is things even like toe tapping or fidgeting, and those actually do contribute some calorie burn issues to your basal metabolic rate. So that's called NEAT. Another thing that contributes to a lowering of basal metabolic rate is how we're constantly in climate-controlled environments these days. So controlling your body temperature in a cold environment actually takes calories burned from your brown fat. And these days we're kind of always at room temperature, and so that may be a part of our lowering of our basal metabolic rate. Another thing that affects how many calories you're burning is the kinds of food that you're eating. So there's something called the thermogenic effect of food. And what that is how efficiently your body can extract calories from the food that you're eating. Part of this has to do with our microbiome or our healthy gut flora, but that's another big topic. But just whether you're eating protein, carbohydrates, or fats. Protein takes more energy to extract calories from the food. So it takes more calories. So if you eat 100 calories of protein, you're only going to extract about 80 calories of energy. Whereas if you eat carbohydrates or fat, that energy is extracted more efficiently and you're going to get out more calories from that food. So if you're eating a diet that's higher in protein, you're kind of burning calories, digesting those calories. more on the effect of what you eat and not just how much you eat is nutritional ketosis. So there's a lot out there now about a ketogenic diet. One other thing about a ketogenic diet, in addition to how it doesn't raise your insulin, is that it's a less efficient metabolic process. So you extract less energy from the number of calories that you're eating when you do it through a nutritional ketosis process, because it's a completely different metabolic pathway than when you're just running on carbohydrates or you're not fat adapted. So for your basal metabolic rate, take a look at your body composition. Keep in mind your height, your gender, and your age, but remember that your skeletal muscle mass is more metabolically active, and you want to make sure you are having a healthy amount of skeletal muscle mass. And if you have lost skeletal muscle mass in the past through weight loss, then you may need to build back skeletal muscle mass before you think about losing additional fat, because your metabolic rate may just be too low. Think about NEAT, or non-exercise activity thermogenesis, and how you can keep lightly moving. Think about your climate and how often you are exposed to the natural elements. Think about the thermogenic effect of food, not just how many calories you're eating, but whether they're protein, carbohydrates, or fat. And then think about nutritional ketosis and how that is a more efficient way of burning calories, and if you're trying to burn stored fat, that will burn more calories. So thank you very much for listening, and stay tuned if you'd like more information.